arms towards the sun. You feel the warmth of the rays, and then you know you're alive, and you don't have to be afraid of anything, 'cause you know the truth, and the truth is love, yes it is. Wasn't what they said to you, or anything that you learn from a book or from the news. It's not like that, 'cause it's a thing. It is something that you do.
Fine. Welcome to the Bassline. Dr. Margaret Aranda is a beacon of light and hope. She is one of the right docs of history. She holds a PhD, she is a retired MD, and she is a prolific independent journalist with a fascinating and invigorating Substack. It is my tremendous honor to welcome to the Bassline the inspiring Dr. Margaret Aranda. How are you, Dr. Margaret?
Hi, I'm doing great. Thank you. How are you doing?
Oh, doing great, and very excited to talk with you this morning. Or afternoon, depending where you are in the world. But I want to...
Can you hear me okay?
Yes, I hear you quite well. Thank you.
Oh, perfect.
Well, let's see. Where do we begin? I want to jump right into the conversation in terms of some of what you've had to overcome in your life. Is it not true that at a certain point you went from being an MD to being a patient in a rather serious situation yourself? Can you tell us some of what you've had to overcome?
Yes, it was actually very unexpected. My daughter and I were driving in front of Pepperdine University, Malibu, on a bright, sunny Tuesday afternoon in perfect weather. And our car was suddenly smashed into by a lady going 90 miles an hour, witnesses said. She T-boned the rear tire on the driver's side, if you can imagine that, and spun us in more than a circle. So we were facing oncoming traffic. I actually walked away. 2 cars were totaled because she actually hit somebody else before she hit us. Me and my daughter, she was only 2 years old. She was in the back seat. And she was fine, but I sustained a traumatic brain injury with diabetes insipidus, which isn't something you hear about very often, but it banged my pituitary gland in the brain. It hangs like an apple and caused my body to not be able to hold on to water, which is incompatible with life. So then she ripped an artery in the base of my neck and the back of my brain, and I couldn't stand up without fainting. I had dysautonomia, which a lot of patients are getting after the COVID vaccine, and I was allergic to the sun, had mast cell activation syndrome. I was incontinent of my bladder, and also food would just stay in my stomach or I would throw it up. So I ended up being bedridden for 12 years, and I went to 25 doctors before I got a diagnosis of the dysautonomia. They treated me like I was crazy, making things up, and wanted to put me on Valium. So I went through the whole gamut.
Wow. Were there any milestones in terms of you being able to sort of make any major improvement to not be bedridden anymore? What was key to improving the situation, at least somewhat?
I think finding the cardiologist finally and having him go ahead and put in a PICC line. I had an IV line that went from my arm into the upper right chamber of the heart area just before that. So it kept fluid going in me, which was actually a little bit of a tragic punishment for me because I kept this bag of fluid going with a pump 24/7 for 3.5 years. So I had to watch the battery didn't run out, the bag didn't run out. So you can imagine as an anesthesiologist and ICU doctor, I was used to looking at those drips going into my patients and checking their IV lines so it didn't clot, et cetera. But it actually saved my life because I couldn't hold on to water. I was urinating more than I could keep in, and I would have died without it.
Wow, what an intense situation. Oh my goodness.
Yeah.
So let me ask you a question that I've asked people in the past, which is, how would you grade yourself on your COVID report card? Because, I mean, there's some people like, I remember Dr. Henry Ely, who's been a guest on this program twice. He said he anticipated this event, that as soon as they said go, he said, oh, it's happening, what we've anticipated for years. There are other people who sort of started putting things together quickly, and then there are other people who were a little bit slower on the learning curve. But what was your experience in terms of just noticing, hey, some of this stuff just frankly doesn't make sense, or some of it isn't adding up properly? When did you realize that things were afoul or amiss in what we were being told?
Got it. Well, I wish I would have been as smart as Dr. Ely. I had been, bedridden for 12 years. I couldn't, even now that time period is kind of gone from my brain. And so I came back to medicine running a pain clinic. And I ended up with about 3,000 COVID patients, and none of them died, except for 3 that went into the hospital. I had to scream at the doctors and try my best, but there were several things that happened when I knew something was slightly amiss, or like something was a little bit wrong, was when that doctor in China, Dr. Li Wenliang, in December of 2019, went online and with a picture of himself with a CPAP mask on, warning people about a coronavirus or a SARS kind of 2 related thing. And that kind of perked my interest, because the police called him in. He had to retract his statements, and then he got sick and he died from it. And now he's a national hero, and they disciplined the police officers involved. But then, so that kind of perked my interest and my suspicions that, wow, why is a doctor telling us instead of the authorities or a health professional from an office of health? So that was odd. And then I knew something was really wrong or afoul when the shot came out. The EUA happened on December 11th of 2020, and then really 4 days later, the first doses were available. So that all seemed pre-planned. And then I was really disheartened that the doctors and nurses in the hospitals in California, they wanted us, the first responders, to be the first ones to get the shot. I'm like, no, I don't think so. I'm not going to do that till 1 million people get it first. Let's see the side effects, et cetera. There was no informed consent. There was no package insert. It was blank. LA, they mandated 60,000 city workers, including the police officers and the firefighters, got the shot to get the shot, and they fought it. The firefighters particularly fought it very hard. And then when they supposedly had ships at sea waiting to have set up ICUs, like emergency ICU beds out there, I applied to get a job as an ICU doctor because I finished Stanford anesthesia and Stanford critical care. So nobody ever called me. So I'm like, okay, there really must not be a need for ICU doctors. And then really, once I decided to segue into prescribing ivermectin and hydroxychloroquine after never having done it before, I realized how hard it was for the pharmacist to dispense it. And I was arguing with pharmacists for a long time before I found a couple that would fill. And then I just stuck with them. But it was obviously like a pre-planned thing that they told the pharmacist not to fill. So all these little things kind of added up.
Right. Interesting. So let me ask you, you mentioned, of course, the jabs, and I've spoken with you on our Stop the Shots spaces on X, and it's just remarkable to me the impact of these injections on the one hand, and then people being totally oblivious to the harm on the other, and sort of not putting 2 and 2 together, even in terms of some of the injuries happening around them. What would you say in general about the COVID injections at this point? I mean, so much has been said. What would you say about COVID injections by now?
Well, they kill. They're dangerous. They're a DOD bioweapon. Brick Jackson's lawsuit against Pfizer as a whistleblower brought that out, that the government is protecting itself from having this shot as a bioweapon through contracts with the Department of Defense. And the courts are protecting that contract because they feel it's in the public interest to not have people avoid vaccines. So the people that are supposed to be serving the people are against the people. So, yeah, this shot's dangerous. It's bad for everybody.
Yeah, I find that so interesting how they derisively use the term hesitant. You're vaccine hesitant. Well, there's a reason why people are hesitant for various reasons, right? Like I'm hesitant to approach a snake, for example.
Right.
If I see, a slithering cobra in the grass, well, yeah, I'd be hesitant to go into that grass, for example. I'm hesitant to eat food off of the ground. Actually, I wouldn't do such a thing. So, hesitant is a natural instinct if you don't feel comfortable about something. And to tell people to just bypass their hesitation, their very reasonable hesitation, I found that incredible that they could dominate language in such a way.
Exactly. And I think what they did in doing that, having that mechanism and that process, was that they bypassed informed consent and failed to have a conversation about the risk-benefit ratio that we have for any procedure.
Right. Risk-benefit, and also a term that I was introduced to, I think by Peter McCullough, which I thought was an underused and an interesting term, risk stratification, to pretend as though everyone is just sort of equally vulnerable to something when that simply is not supported by the facts. That was, one of the many remarkable features of the whole thing. But I also would love to ask you, and we're kind of flying along here, but I like that because it leaves me question time for later in terms of some other interesting things that we could discuss. But I would like to ask you about your phenomenal Substack. I find you have a very interesting Substack, I must say, as a fellow Substacker. One thing that's great about all these terrible things that's happening, a silver lining has been we have these doctors who have emerged now as independent journalists, which is quite incredible. Mm-hmm. It seems like a lot of doctors were being censored, and they said, you know what, I'm going to have to write my own articles to get this information out. And some of them have taken to it like fish to water, and they're doing such a great job just, cutting out the middleman and doing this great job as sort of medical journalists. But then with your Substack, I find it so fascinating, and I really enjoy the fact that you not only cover a wide range of things just within the medical domain, but then you cover any number of other news items and just sort of a very wide range of topics that you jump right into. I really enjoy that. What is the animus behind your Substack? How do you go about it? What's your process?
Thank you. Well, I think to explain why I am able to jump around so much, it's a curse and a blessing sometimes, but I'm left-brained and right-brained. So I have a very creative side, which allows the writing and a little bit of art and music, but I am also very left-brained, which is the science and math part of it. Really, God healed me from my bedridden status, and it made me able to walk and talk and live longer than I should have and defy the medical odds. So I have this constant, feeling about life every day that I shouldn't even be here to speak. Like I couldn't even say the word "the." So when I write my Substacks, they're all written spur of the moment. Nothing is pre-planned. Hardly ever do I schedule one in advance, which you're able to do, to say publish on Monday at 2:00. And a lot of times I sit down with a blank mind, like, God, bring me something. I pray. I'm like, God, bring me something. Like, let my eyes fall upon something that you want me to write about. And usually I go to Twitter. or X, and I find something pops up in front of my eyes, and I actually I take a screenshot of the tweet. I give the link to it. So my Substack is like the tweet, and then the video, if I can download the video of something, which I usually can, and then the thread. And I find it so interesting to see what people say about different things, whether it's vaccine injury, glioblastoma we were talking about yesterday, and those things. And then I always have the next structure is a section where I put what I really think. So I editorialize, like, this is, not good, et cetera. So I try to keep my editorial opinions out of the context of the writing above that. And then I like to end with a prayer to God, and also a video, a worship video, so that I can bring the person's brain around from something really upsetting like genital mutilation surgery, and, abuse of children, murders in the hospital. I mean, we're talking some really big forensic kind of subjects here. Mm-hmm. And I like to pray for the people that are affected and ask God to spiritually lift us up at the end of it. So that I like that angle for myself as well. Thank you.
Wow, that's beautiful. So I guess I would like to venture into sort of a difficult topic in some ways, and it's just but a broad topic at the same time, and it's something I'm writing about, something I'm thinking about a lot, and it's just this question of what, frankly, is COVID, because you have people who say there's no such thing as viruses, and there are people who say, well, I'm not saying there's no such thing as viruses, but I don't believe there's such thing as a COVID virus. And then you have all of this happening in a sea of PCR fraud, basically the total misuse of the PCR fraud. There came a point where it seemed that anything that brought you to the hospital could then be turned into, this is COVID. I was joking that, nowadays you get a COVID sprained ankle. And someone, after I'd made that joke, someone said, when I got COVID, my wrist started hurting. And I'm saying, how do we translate severe acute respiratory syndrome to just, I tested positive on a PCR test, and then anything that ails me is now being called COVID? So I just wonder, and then I'll also add to that, of course, we had this global pandemic frenzy, and we were being warned that, there was this virus just wafting in the air, and who's going to get it next? And we were being constantly updated, the number of cases, the number of deaths, and the constant media frenzy around it. And now, that's all died out. And now it's just, you hear about COVID from time to time, and you hear people mentioning, oh yeah, I tested positive for COVID again, but it's just, now he just sort of pops up here and there. How does it go from being this virus that just took over the world to being like, just a regular old virus on the block now?
Exactly. First of all, I'll verify that nowhere in medical school did we ever isolate a virus or look at one under a microscope. We looked at bacteria and, the histology under the microscope of the tissue and what each one looked like, different things like that, and how to identify them by doing different stains and growing them in different culture media. So, but, the whole, whether there's a virus or not, frankly, I don't feel like I have to argue whether there is or not. The problem is that there's something out there, and it very well could be man-made. There's something that goes around that people catch from other people, and they get sick from it. And you take certain things, and they help you get better. And so on the PC, and then happy to say this morning that Trump just canceled a $150 million contract with Moderna on a new mRNA.
Oh, no, I didn't pull my stocks off the market. Sorry, I had to jump in there with that.
I know. So that was that. Canada, they had the bird flu with that 400 flock of ostriches that they culled after a protest, and RFK Jr. even wrote them a letter. They did it anyway. Yeah, they're trying to scare us and fearmonger us, so we have to be careful what we watch on TV. And one of the great things that happened with all of this COVID stuff, like you were saying, this medical freedom movement, a lot of us got to meet one another, and I never would have known you.
Right.
Like it brought together a lot of like-minded people, and we need to keep shining the light on the darkness and supporting one another and helping get different words out that different people have. But you're absolutely right about the PCR test. Kerry Mullis himself said that it was never meant to diagnose anything, and I have personally run PCR tests when I was at an East Coast Ivy League university. So I know you can turn the dial up and you can make something show up that isn't supposed to. And they turn the dial way up. So if they find a bicycle seat, they say you have an entire bicycle. So they manufacture the positives.
Right.
Yeah.
It seemed clear that was happening. And I mean, so many incongruities all around the world. I mean, one of the outstanding things that I think doesn't get discussed enough is the lack of total deaths in China. I just find that a little hard to believe that we exceeded 1 million COVID deaths in China with a much larger population, and supposedly the place of origin of the virus didn't manage to officially kill 5,000 people in China, to which people say, oh, well, they're not keeping good records. We can't trust the Chinese government. But then my response is, well, then where are all the bodies being hidden? I mean, are you saying there was just this mass death event that was just completely hidden from the global public, completely erased from history? And, and how many more deaths, if you're saying it's more than 5,000 or, I don't remember the official number or know what now would be the official number out of China. But last I checked, it wasn't even 5,000 deaths when we had exceeded 1 million, supposedly. I want to...
Exactly.
Go ahead, yeah.
And you're right about our statistics in America have exactly to do with the government incentivizing hospitals to say that people had COVID in the ER, admit them to the ER, from there to the hospital, like Scott Scherer's daughter and Rebecca Charles's daughter. We've got Leslie Batts and Peg Hockett, whose husbands both were admitted. They all said they had COVID. They all put them on protocols, plus or minus remdesivir, ventilators, opioids like morphine, anesthetic drugs, benzos like Valium, long-acting lorazepam. And then they got paid for saying that they died of COVID, even if they made them a do not resuscitate, so nobody did CPR on them or breathed for them when they stopped breathing because they overdosed them on different things and these combination drugs. That was a protocol that America followed, and there are articles. I have one. In Florida, for example, a man comes in with a motorcycle accident and dies, and the cause of death is COVID. They got paid for it. Every state got a different amount. They got paid for by the governments to follow the protocols. So that drove the numbers up artificially and caused fear in people. So they would get the vaccine.
Right, exactly. Another really important point of comparison is just comparing the U.S. to Canada. That's something that hasn't been done quite thoroughly enough, because while there was some sort of COVID impact apparently reported in Canada, ours is just exponentially more significant, which makes you have to ask, wait, what's going on? Are Canadian people just that much tougher and that much more durable than Americans? Or we say, are Canadian doctors that much better than American doctors? How could we have such a terrible outcome relative to Canada,
Right.
just even if you adjust things to scale, with our population, of course, being larger?
Well, and it makes it sure look like America has the stupidest doctors in the world.
Yeah. Yeah, if you want to put it
Right?
that way, yeah, seriously.
Yeah. Like, why can't we be as good as India? Even India had better rates. South Africa, they didn't get the shots, so they did well.
Right. But although it's interesting because South Africa it seems that South Africa had the worst COVID outcome in all of Africa, which is strange considering they have the most resources in general. South Africa's richer than possibly any other country, probably any other country on the continent, I would say. So, it was also where shots were administered more than other places, where in some places they were almost, the uptake was very low, although sadly, it's not zero. And, my mother, she actually sponsors a village in Malawi. She pays for children to go to school and school supplies. She does a lot of that kind of stuff. It's pretty remarkable, the kind of activism my mom has done over many years. She has an organization called 4 Our Children's Sake Foundation. So she sends, clothes and school supplies to like Haiti, to Malawi, to Native American reservations, as many people as she can help. And she has gotten reports, unfortunately, from Malawi that there have been died suddenly cases after, X number of people received their quote unquote vaccines, which I would like to ask you in general, what are your thoughts about vaccination as a practice in general? Because I'm one of the people that was not an anti-vaxxer, as they call it, leading up to this event. And it was through this event that, first I rejected the COVID injections wholesale, but then I started to listen to any number of people, including guests on this program, who were adamant that vaccination as a practice is a dubious practice at best, and actually a detrimental practice, truthfully. And as of, I guess, maybe even a week ago, I've graduated from anti-vaxxer to now I'm taking the term that I was introduced to by my friend and guest on this program, Dr. Leonard Horowitz, who declares proudly he's a vaccine abolitionist. He's beyond anti-vaxxer. So not to put all those thoughts in your mind, I'd love to hear what you think about it, but that's the journey that I've gone on. I've become a vaccine abolitionist through all of this. But what are your feelings about vaccines?
That's the first time I've heard that term, and I absolutely love it. So I will join that category with you for sure. There are a lot of studies that show that the cause of death from the disease is lower than the cause of death from the vaccine, whether you're talking about the MMR, the DPT, especially the childhood vaccines. You're more likely to die after you get the vaccine than just getting the mumps or the measles. So, and there's no prospective, randomized, double-blind, placebo-controlled studies proving that any of those vaccines work. And actually, a lot of people don't know this. In January of 2023, Fauci and several other people together published a paper saying several things of great importance. One, the flu vaccines have never worked. The flu might, changes, and by the time it gets here, the vaccine already doesn't work. Number two, we never should have thought that the flu vaccine would stop a pneumonia because there's no way for the immunoglobulin A from the mucosa of the lungs, which is what you need to get it in there, to possibly get antibodies that arrive from a shot in the arm. And Dr. Joe Lee is the one who sent him a 100-page letter telling him all that because he's a basement membrane anatomy of the eye kind of guy who said you can't get a shot to the arm to go to the lungs to stop anything. Number three, Fauci concluded that we need, quote, new generation shots from eye drops, aerosolized, or nebulized shots, was his conclusion of the paper. So Fauci himself admitted in a published, readily available journal that the flu shot doesn't work, COVID shot wasn't going to work, and we need to scrap those and go with something that gets a nasal drop, an eye drop, or inhaled.
Wow. Great information there. And I find it to be such an abomination. I don't know how many other states have this outrageous policy, but here in New York City, a child cannot attend preschool without having a flu shot. And what is the medical basis for that? How many children have supposedly died from influenza? And I really wonder, what is happening in the bodies of those children. I mean, any number of kids can receive their flu shots, and they are more or less okay. Thankfully, they're not being thrown necessarily into some acute response. They go about school, they attend school every day, they're apparently fine, but this stuff has been injected into them. And what does that do on a long-term basis? I would really like to know, and I wonder what information do we really have about these contents being inserted into people. Dr. Judy Mikovits has indicated that those adjuvants and other contaminated elements of these injections are seeding our bodies for long-term injury and cancers and so on and so forth. Have you looked into that discussion at all in terms of the long-term effects, increasing overall increased cancer rates across society that correspond with our increase in vaccination practices?
Exactly. I mean, look at the components of the shots, everything from whether it's aluminum, the thimerosal for children in particular. I actually have on an article on both Substack and on Twitter, X, that shows 25 studies that link the childhood vaccine schedule to autism and a summary of each one. And, our new parents, our expectant mothers, really are, a lot of them are doing the research, and I think they're just finding out for themselves that a lot of these myths that we grew up with just accepting were also lies. And I'll throw in there that Fauci's paper that I mentioned was in Cell, Host, and Microbe, a major journal that's on PubMed, government-sponsored website that hosts all of the journals. And his title was Rethinking Next Generation Vaccines for Coronaviruses, Influenza Viruses, and Other Respiratory Viruses, and that was Volume 31, Issue 1, pages 146 to 157, published on January 11th, 2023, after Fauci left his office. And inside that article is a whole discussion about the flu shots as well. But if you look at the heavy metals like aluminum and mercury, SV40, which they pulled the polio shots. Salk never got a Nobel Prize for the polio shots. A lot of people that got polio, they say got it from the actual shot. And also you're looking at graphene oxide, right, from the shots as well. All those different things, the myocarditis, all the big side effects, the sudden death, et cetera. There's React 19 is the only organization I know that has taken vaccine injuries and deaths and is worldwide and is trying to formulate a paper or some conclusions from it. So hats off to them, because somebody somewhere needs to be doing that. It's a gigantic feat.
Yeah, it's so fascinating how they describe the polio injections as this breakthrough in human history with just nothing terrible that happened. And then it turns out, oh, wait a second, there was this thing called the Cutter incident where these contaminated batches had just outright given people polio, and many people were severely injured and many more people died. And it's just, I find that historically so strange to tout this as this marvelous event and not even mention, oh yeah, and we also killed a bunch of folks too. Too bad about that part, but it was really great though.
Exactly. It's just, America needs to do better. And I would add to this that the current CDC website on COVID vaccines isn't saying don't vaccinate children 6 months and older with a COVID shot. It's saying you could talk to your doctor about it. It's an individual decision, pretty much. Like if a parent wants to vaccinate a child with a COVID shot today, the CDC website pretty much says that it's okay, instead of saying it's not indicated for any child under any situation if they're healthy. So that's a big disappointment to a lot of us. And actually, Dr. Mark Bartlett had a tweet today saying that he was ghost banned for posting the actual CDC screenshot from their website.
Wow. Yeah, I mean, it's an interesting thing that I find it strange when people say, oh, well, people should have the right to choose. I don't really think you should have the right, per se, to be poisoned in a medical institution. I find that to be a strange thing to declare as a right. Like, if we can determine that these things are toxic and harmful, well, no, I don't think it should be your right, quote unquote, to receive these things in a place of medicine where we're trying to improve your health and your longevity. And instead, we're doing the opposite. We're putting toxic substances into your body. I don't really consider that a right in that sense.
I think especially if you look at the parents making that right decision for their children, it's really not their right either. You still have to do what's best for the child, and and weigh the risk-benefit ratio. There really aren't any benefits of it.
Yeah, seriously. And
so there's only risk.
I agree. And, I'll also say, I'm someone, because I host this program and because I host spaces on X, the Stop the Shots community nightly spaces, I get a lot of heat in my inbox, and there are people claiming that I'm anti-science and I'm an anti-vaxxer and I'm this and I'm that. And my point has always been, first of all, the premise of what I'm saying is based on my right to say no. Irrespective of all sorts of elaborate scientific vocabulary and concepts. Hey, it's like, hey, great for you and your scientific vocabulary. I don't want anything to do with it. Can you just leave me alone? I'm alive on the planet now. I'm breathing air. I can drink water. I can eat dinner tonight. So why do I need elaborate concoctions, and why is it offensive to people if I decline that? But, also this notion that the anti-vaxxers are the ones who have created this atmosphere. Well, why don't the health authorities take some responsibility for all of their backpedaling and all of their contradictory language and all of their false claims that they later admitted were false claims? Like, if you take these injections, you're not going to get COVID, is what Joe Biden said, and any number of people declared so adamantly that you're protected from COVID. And they say, oh, actually, wait a second, there's something called a breakthrough case. Oh, wait a second, you're going to need to take boosters for the rest of your life. Kind of a different deal than what you were selling in the first place. So how these people then turn around and blame vaccine hesitancy, as we discussed earlier, or the low vaccine uptake on just the anti-vaxxers, well, maybe they should look in the mirror about how contradictory they've been, how unclear they have been, which is a whole other thing, which is, this whole notion of misinformation, disinformation, malinformation is my favorite term. But this notion of that being dangerous, and my response to that is, well, why don't you just provide clear information? And then we wouldn't be confused so easily by so-called misinformation, disinformation, malinformation. But the public health authorities don't seem to want to take any responsibility for the atmosphere of confusion that they have created.
What's really interesting too is that I found cartoons from 1885 about disinformation. The government, pointing to people for spreading disinformation. Figures of a skeleton man injecting a baby whose mom is holding her with a policeman with a hat standing behind her. They have been doing this to the population since the 1800s.
Wow.
They have it down. They know exactly what they're doing.
Yeah, seriously. I think this is the struggle of our times. I've always been concerned with human rights in every area where it was challenged. I'm adamant that every person should be treated with basic dignity and respect, should not be in any way oppressed or denigrated. And I've realized through this struggle that all of that emanates from bodily autonomy, the sovereignty over your own body. That shouldn't be turned into an abstract thing. That shouldn't be something that we debate. It should be something that we know and something that we respect. And until that's the case, our work clearly isn't done. I would like to invite callers to join us. If anyone would like to talk to the learned and wise Dr. Margaret Aranda, the number here is, of course, 888-874-4888. We'd love to hear from you. 888-874-4888. Hopefully we're not having problems with our phone lines today. This is a work in progress over here. The PRN studios have moved. It happened several months ago, but it's a big technical operation to move a radio station from one location to another. So we still iron out technical problems from time to time, but we're here, we're consistent, and we have a great audience, and we'd love to hear from you guys. So if you'd like to talk to Dr. Aranda, please give us a call, 888-874-4888. And in the meantime, Dr. Margaret, can you tell us about all the various places where people can keep track of you? How do people find you on X? How do people find your Substack, et cetera, et cetera? I'd love for people to be, in tune with all this great work you're putting out.
Thank you so much. And I appreciate PRN Studios as well. It's a wonderful outreach that they have. I hadn't heard of it before this, so I'm going to be listening more often. Thank you. The easiest way to find me is just to remember the Rebel Patient. So I'm at the Rebel Patient on Twitter, X, and also Substack, The Rebel Patient, which is at therebelpatient.substack.com. Those are my two media. I'm not on Facebook. I'm not on Instagram. I'm not on other things. Pretty much those are the only two places to find me. I've got 4 books on Amazon. I've got children's books, which a lot of people don't know about. Little Missy Two Shoes Likes the Ladybug, teaches little preschoolers and young children how to like gardening and not be afraid of bugs that are outdoors, especially ladybugs. And then it's a cartoon book. And then once they get to know her, the second book is Little Missy Two Shoes Likes to Go to School. So it's really good for vacations and the end of summer vacation or holiday vacations when the kids hate going back to school and they're screaming and crying. Well, Little Missy Two Shoes was the same way, and she teaches them. She actually, I've had parents say, my kid used to cry every day, now she doesn't cry anymore. And then I've got my book about my near-death experience and my conversation with God that led to my miracle of healing. No More Tears is on Amazon, as well as my guidebook to low back pain, which has a lot of just general information, too, about wellness.
That's incredible. What outstanding stuff you've done. I hope everyone looks into all of that. That sounds great. Those books, all of them sound phenomenal. So everyone, please keep an eye. Yes.
Yeah, I give them away for free. If anybody can't afford it and they want it, just get a hold of me through either one of those two, the Substack or Twitter, X, and I'll email you the PDF.
Oh, that's phenomenal. Yeah, so please, folks, that's very generous. If you can buy the books, I encourage you to do so. But if you can't afford it, you heard it. Dr. Aranda said she will make it available to you. So please look for the Rebel Patient on X. Please look her up on Substack. Like I said, very rich Substack. All kinds of topics are covered, and I think that's extremely cool. The diversity of what you cover. So let me ask you something else, Dr. Margaret, which is, and this is sort of a tough question. It's kind of tough to think about, honestly, considering how many people I love who took these shots for one reason or another, whether they thought they were doing the right thing or they were simply intimidated. A lot of people were really put into a back against the wall kind of situation in terms of being behind on their bills, because that's another thing, of course, we forget. A lot of people were being told, you have to take this shot to return to work after they had been prevented from working and their debt was accumulating. They were often behind on rent and mortgage payments and all this stuff. Many people, of course, have kids as well. And they're saying, so what do I do here? Do I not take this shot and then I move into the homeless shelter with my kids? A lot of people just, they prayed, they hoped for the best, and they took the shot because they were under intense coercion, which I don't think should be understated. But my question is, whatever the circumstances under which people took these shots, Do you think it's possible for someone to have taken these shots that have proven to be so injurious in so many cases and have not harmed their health on some level? So could someone have taken their mRNA injection and basically wound up just unaffected? They're okay. It's all sort of been processed through their body, and they were going to live till the age of 96 or whatever, and they're still going to live till 96. They got lucky. Is that possible?
It is, and I'll tell you why. I think it is, and this is how I know. This is one of those situations where common sense goes a long way in medicine. So you have the people that took the shot, and they're walking around saying, I took the shot, it didn't even hurt. I didn't even get a fever. I didn't have anything go wrong with me. And then you've got the other people that said, I got a big, huge lump. I got swollen lymph nodes on that same side. I was throwing up. I got a headache. I ended up with, dysautonomia. I've been permanently disabled ever since I got the shot. Well, how could that possibly? How could those two be true? And my reasoning is you can go to howbadismybatch.com, howbadismybatch.com, look up your batch number and look at the number of people that have been injured or killed. And they, in my opinion, had to have given out normal saline, saltwater shots with absolutely no mRNA in them. In some of the places that had people, get their shots in the heat of the summer in a big stadium or in a parking lot, there's no way that they could have kept them cold enough. So they were probably inactivated mRNA shots by then as well. So there are people that got a shot that didn't have anything in it. Just like Dr. Kirk Moore in Nevada gave normal saline shots with patient consent and has already been jailed and thrown into solitary confinement for 22 days and is facing 35 years in prison for doing that because his patients wanted him to, allegedly. So, yeah, the government was allowing people to get normal saline shots, in my opinion, and they're never going to get sick because they didn't get the shot.
Interesting. Yeah, I certainly hope you're true, or what you're saying is true and correct, because it's just terrifying to see, people who on the one hand have had their health completely ravaged, and then people on the other hand who were perfectly fine, or so it appeared, and then dropped dead. Were socializing the night before, went to sleep, and didn't wake up. It's amazing. I can't believe it, but my mom is on the line. Hi, Mom.
Oh.
Can you hear us, Mom? I don't know what happened. Can we get her through? Rob, Dylan, I don't hear the call. Oh, she dropped somehow. Call back, Mom. Or
there you go.
Yeah, or whoever else would like to call, 888-874-4888. We have just a few more minutes, and we'd love to hear from you. But in the meantime, Dr. Margaret, what have you discovered in terms of actually, let's go to a call right here because we are running out of time. So let's hear from Muhammad. How are you, brother?
Fine, thank you. Good afternoon, Jeremiah. I would just like to say the doctor you have on now, she brought up about the graphene being in there, and the doctor that was on, Dr. Love,
yes,
she said it was graphene oxide, anthrax, formaldehyde, cyanide, and methane blue. I read it about 12 times. Every time I read it, I learn something new. So it's a lot in there, and your show is very interesting. You're doing a wonderful job. And just keep the good work up, and thank the good doctor that's with you also. I noticed she talked about graphene too. All those, or that anthrax, that's a military-grade weapon. What in the world is that doing in a vaccine?
Yeah, seriously.
Anyway, have a good day, and thank you very much for your time, Jeremiah.
Thank you so much, Muhammad. Yeah, I appreciate you greatly. Very supportive audience member who is just, very encouraging.
Beautiful.
And I really appreciate you, Muhammad. And so do you have any comment? My mom is back on the line, so we're going to hear from her in a second, but I would love to ask, do you have some comments about the graphene discussion? Because it's quite a dividing line. Some people say this is absolutely going on and we need to wake up to it, and other people say, oh, stop talking about that. That's crazy.
Yeah, if you're worried about that because you got the real jab and you've been sick, I think it's wise to worry about it because you can't lose anything by doing something to perhaps treat it. My number one thing that I say to people, I'll follow Dr. Brian Ardis on that, is nicotine. So nicotine is not a drug. It's not addictive. It's in every lampshade, nightshade, vegetable like eggplant and cauliflower. It's a natural compound, so you can chew the Nicorette gum. Knick-Knack has some Nicorette lozenges, and patches is what Dr. Ardis recommends, which also reverse myocarditis as well, according to a government article that he found. So, yeah, there's different things you could do to try to offset the shot if you got the real thing. Nicotine is one of them. Another one is augmented NACI-like. There have been a lot of really good clinical turnarounds from that on symptoms.
Right. Thank you for that. Mom, are you with us? Can you hear it?
Yes, I am.
Thanks for calling.
Yes. Yeah. Thanks for having this
Beautiful.
show. Fabulous. Yeah. What I wanted to share, a couple of things quickly. One, when the polio vaccine came out, my mother refused to have my sister and I get the vaccine because she said the first batch is going to be the test batch, and let's see what happens to those poor children who get that shot. I'll wait till the next batch comes out. And sure enough, many of the children who got the first shot, they had something that was too intense, and those children actually came down with polio.
Mm-hmm.
And
wow.
they refined it, and then the next batch that we took, then we were okay. But that's really terrifying to know. And that they just take that as collateral damage, unfortunately. And then my other point was, what a lot of people don't realize is things that are banned here, they then export it to poorer countries and pretend that it's okay. And that's how a lot of people die. Like even when they give you all of the, if you take this medication, these are the side effects, people don't think, who did they experiment on to know what the side effects of these drugs you see advertised on television ad nauseum. These are actual human beings that were used as basically test guinea pigs. Tell you, this is what happened. And there was a great film called, and it was about the fact of the drug company going to different African countries, et cetera, to experiment on the drugs. And then the people who die, then they have an autopsy and tell you all the side effects, but then they kind of disappear in the records in that country, in the hospitals, of what happened to them. And nobody associates, this innocent test, because of course they don't tell the people, this could be fatal. And it's a very interesting film called The Constant Garden. Even something like Roundup, they know that it's carcinogenic, and yet they're pushing it on farmers in Malawi and I'm sure in other countries around the world, and they know it's carcinogenic.
Right.
So I warned my farmers about it, and so they refused to take it.
Yeah. And now, unfortunately, the same thing is happening with our country, where we're allowing our own citizens to consume things that are banned in Europe. So
Exactly.
we don't have very high standards for ourselves now at this point.
Even to hear that these bright-colored food dyes are petroleum-based, and then we're wondering why we have such a soaring cancer rate in our country. It's insane. While in Europe, they're using plant dyes, which that makes sense, but not petroleum-based, so that they'll be even brighter to attract children, once again, children. And now we have so many children with all kinds of horrifying cancers, et cetera.
Well, thanks for calling, Mom. Yeah, go ahead, Dr. Aranda.
That's a great perspective. That's a wonderful perspective. And thank you for your work with For Our Children's Sake as well. But it's wonderful to hear a perspective from polio, the polio shot when it came out, and how wise your grandma was to remind her, ditching the first batch.
Yeah, at
Exactly.
least. Well, I want to thank you so much, Dr. Margaret Aranda. You are a very inspiring figure and a beacon of light, as I said. So I really hope everyone looks into your work. Please subscribe to her Substack, follow her on X. A great figure in this medical freedom movement, and we're so glad you survived that unbelievable accident that you experienced, and that you're still here to share your wisdom and your insight. I look forward to speaking with you again soon.
Awesome. Thank God, too. Thank you. God bless you. Appreciate you.
Thank you. You too, Dr. Margaret. And thanks to everyone for listening. Thanks to PRN, Dylan and Rob. Shout out to hardworking engineers in the next room. And, stay in touch, folks. We're going to have a special guest tonight on Stop the Shots, and we'd love if you tuned in. Just search for Stop the Shots Community on X. Please join us. That is, as I call it, a living petition. Have a great weekend, everyone. Peace and love.